as a geneticist, I'm a big proponent of genetics being involved early. And hopefully the geneticist can assist the neonatologist or the pediatrician in sort of navigating through the current variety of tests that are available, and with different time courses and different coverage of the genome and so forth and so on. So that's certainly the first thing I would recommend: get genetics involved early, and make them help you deal with these questions. I'm also a big proponent of at least having the sample. So a real tragedy that we didn't talk about this morning is a family in which the child is not diagnosed, and it turns out to be a recessive disorder, and you don't really know that until they have a second child, and then you have the pleasure of telling them that not only is their first child affected, but their second child is affected. So, and then the third thing that I'm just on my mind, because we had a recent case conference that related to this, and a mistake that's sometimes made is that people say, well, I thought of this syndrome, but it's very rare. And those frequency numbers come from the whole population. So disease X could be extremely rare in the general population, but then if you say, well, how frequent is it in, sick newborns that have a metabolic acidosis and elevated this and reduced that and so forth, then it turns out it's not so rare. And so don't be misled by the standard frequency that's in textbooks about how rare things are. You have this bias, basically, that now you're dealing with a symptomatic newborn and things, the frequencies change there. So at Hopkins right now, we're developing our clinical pipeline, so we're still sending clinical whole exomes out. And so I guess I can't tout which one. I mean, we send them to Baylor. But most of those services right now are a relatively slow turnaround. So I think one challenge for clinical genomics, and one that was appreciated by Stephen Kingsmore and his team, was that if you really want to use this in real time, you have to have a rapid turnaround. He achieved, and I think rapid turnarounds are increasingly possible if the laboratory understands what it's like to be a clinician on the front lines with a sick baby on your hands. One thing that will be a terrible outcome of the application of genomics to medicine is if everyone turns their brains off and just sends the test out and says, I'm not going to think about this until the test comes back. This test will never replace a critically thinking neonatologist or pediatrician who is constantly asking themselves, why does this patient have this problem? And so it's a new test. It's a kind of new area to test in. It's getting better and better, but it's no substitute for an alert physician.